Now, your health, your safety. This is ABC7 News.
Good afternoon. I'm Kristen Z. Welcome again to our daily special called Getting Answers. We're asking experts your question every day at 3 o'clock here to get answers for you in real time. So today we have a 2-for-1. We have an infectious disease specialist from here and an employment attorney for the entire half hour here. So you can ask questions to either one of them, your health and your employment money situation. So post your questions now on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. We are also, I should mention, waiting for President Trump's news conference on reopening the economy, the nation, the guidelines. He is expected to lay that out. So when that happens, we will take you there live. But first, joining us to help you get answers today is employment attorney Angela Reddick-Wright of the Reddick Law Group, coming back to us. Thank you so much. And Dr. Peter Chin-Hong, an infectious disease specialist and professor of medicine at UCSF. Thank you both for coming on today.
My pleasure, Kristen.
Thank you.
Very nice to have you. Peter, I think I'm going to start with you. President Trump is expected to say governors can start reopening May 1st if they want. And Governor Newsom here in California has made it clear he won't in California until 6 conditions are met. One is to have the ability to closely track and monitor potential cases. So Dr. Chin-Hong, tell us, we know that UCSF and San Francisco have started this contact tracing program, but really we're still hearing about testing shortages, delays getting results. So how far away are we from meeting that condition for reopening here?
That's a great question, Kristen. I think a lot of people are working in this area, but I totally agree with Gavin Newsom. We're not ready yet. We want to be ready so that when we do it, we don't have to disappoint people and enforce restrictions all of a sudden. So I think, like you said, we don't have enough testing capabilities still yet. I mean, people are working on that, for example, looking at alternative swabs. Our colleagues in Hong Kong have published on using saliva, so early morning saliva, as a way to get around swabs in the first place. So I'm kind of excited about that. The FDA approved the saliva test yesterday, so maybe that will add to our options that we can roll out into the community.
Right. I mean, all that is promising, but would you say boots on the ground, the story here for real is still that it's hard for people to get a test and there are not enough tests to go around at this point?
We are still unready for that. We haven't set up community screening centers yet. We have to have a reporting system in place. And we want to do something good if we roll it out, not do something half-hearted.
Okay. One more question for you, Peter, before I get over to Angela, and that is an alarming study I read about out of South Korea, which is dozens of people who recovered got sick again, but it looks like the virus reactivated as opposed to those people getting reinfected. What does that mean to us? What does that mean, and what is the implication for immunity?
So it means, I think, first of all, we need more information. Like, I don't really know what else they tested for. So whether or not they had COVID-19 leftover RNA from the previous infection, and maybe they got another respiratory infection, because this is, of course, still in the realm of respiratory virus season. We're getting out of it. I need to see that data first to really understand, without saying that COVID-19 has mutated. I don't really think it's going to mutate as much, say, like influenza or other viruses, just given because the fact that it's just one main thing. They're different strains, but they're very subtle differences between them so far. Of course, we need more information.
Absolutely. All right, Peter, hold on one second, because I do have a question for Angela as well. And that is another headline this week and yesterday, that the $349 billion lending program for small businesses under the stimulus has run out of funds. That means, of course, those businesses may have to lay off more people. So is there recourse or another alternative on the horizon for small businesses?
Yes, it's really unfortunate. And actually, when the CARES Act, which provides those stimulus funds to businesses, was passed a few weeks ago, it was predicted that the funds would run out right away, because businesses, of course, were rushing to apply as soon as they were able to apply. So I'm hearing two things. One is that Congress is considering a second and possibly even a third stimulus package. So hopefully, if they do that, that it will include additional funds for businesses. And then, of course, local jurisdictions such as San Francisco and Los Angeles and other major cities around the country are considering their own stimulus packages for businesses. So those will be opportunities as well as many companies, especially for small businesses, are providing grant programs and other opportunities for small businesses to apply.
Okay, that's good information. Something else that a lot of people are wondering about that Roy Longoria is asking us on Facebook is, can you still file? I assume he means the tax forms that, from last year, that those stimulus checks are supposed to be based on, whether you're eligible or not. So if you didn't file last year, can you still do it now?
Yes, so the filing of tax returns, that's for individuals that are seeking to get the $1,200 or couples that are seeking to get up to $2,400 through the federal stimulus. So you can still file. You may get, a little behind in line in terms of those who've already filed and have all of their paperwork and their bank information in place already. But you can go to the IRS's website and still file your tax returns and work with an accountant, of course, if need be.
Okay, Angela, this question is coming from someone on Instagram. They're asking, can you quit and still get unemployment?
Well, you know what? I just spoke to someone today about that very same question. So if you quit, meaning, there's an opportunity for you to work and for whatever reasons you decide that employer is not the place for you anymore, then most likely you would not get unemployment. But if you quit because you feel that your employer hasn't provided safe conditions, for example, in order for you to work under the COVID-19 circumstances, or provided you everything you need to work from home, or somehow putting you in danger in some way, then I would say that that's possibly what we call in employment law a constructive termination, meaning you had no other option but to quit. In that instance, you may still qualify for unemployment benefits. But yes, the rules are still the same. If you quit, then most likely you would not apply or be eligible for unemployment benefits.
All right, Peter, a lot of people are still wondering about, hang on one second. President Trump is starting his briefing. So we're going to go over there right now and take a listen.
Of the American people. These have been trying times. A cruel virus from a distant land has unfairly claimed thousands of precious American lives. To every citizen who has lost a cherished loved one, your pain is our pain. We mourn as one national family. Our country has come together. We draw solace from the faith that God has received and the departed. He has taken the departed into his eternal and loving embrace. They will never be forgotten. Over the last weeks and months, millions of Americans have joined together in a shared national sacrifice to halt the spread of this horrible disease. The Army built field hospitals and sports arenas and convention centers. The Army Corps of Engineers is great. Over 20,000 beds in record time. The Navy sailed hospital ships to our biggest cities. Life-saving supplies and experimental medicines were rushed to the front lines as we launched a rapid search for groundbreaking treatments and vaccines. We built the most advanced and robust testing anywhere in the world, and we've done more testing than any country anywhere in the world. We suspended dangerous foreign travel. We leveraged our industrial base to produce vast quantities of critical medical gear and enacted a historic $2 trillion relief package. Through it all, we have seen the heroism of our doctors and nurses like never before. These are our warriors. The bravery of our truck drivers, such bravery, and food suppliers, such incredible bravery, and the determination and drive of our citizens. Through this unified national endeavor, we have made great progress you could really say incredible progress. Our experts and scientists report that our strategy to slow the spread has saved hundreds of thousands of lives. Models predicted between 1.5 million and 2.2 million U.S. deaths. If there was no mitigation, it could have even been higher than that. And between 100,000 and 240,000 deaths with mitigation. It's looking like we will come far under even these lowest numbers. Thanks to our all-out military operation and the extraordinary devotion of our people, we believe we will experience far fewer deaths than even the optimistic projection, but there is no such thing as an optimistic projection on death. One person is too many. Our experts say the curve has flattened and the peak in new cases is behind us. Nationwide, more than 850 counties, or nearly 30% of our country, have reported no new cases in the last 7 days. Because of our early and aggressive action, we have avoided the tragedy of healthcare rationing and deadly shortfalls that have befallen many other nations, nations which, wherever possible, we are helping. In America, no person who has needed a ventilator has been denied a ventilator. We're making hundreds of thousands of ventilators. We've delivered thousands and thousands of ventilators to the states. And actually, it's been an incredible operation. We started with very little, and we ended with a lot. The United States has achieved a significant lower mortality rate than almost all other countries. Based on the latest data, our team of experts now agrees that we can begin the next front in our war, which we're calling opening up America again. And that's what we're doing. We're opening up our country. And we have to do that. America wants to be open, and Americans want to be open. As I have said for some time now, a national shutdown is not a sustainable long-term solution. To preserve the health of our citizens, we must also preserve the health and functioning of our economy. Over the long haul, you can't do one without the other. Cannot be done. To keep vital supply chains running, these chains have to be taken care of so delicately. They're delicate. The balance is delicate. We want to deliver food and medical supply. We must have a working economy, and we want to get it back very, very quickly. And that's what's going to happen. I believe it will boom. A prolonged lockdown combined with a forced economic depression would inflict an immense and wide-ranging toll on public health. This includes a sharp rise in drug abuse, alcohol abuse, suicide, heart disease, and many other dimensions of physical and mental well-being. Moreover, many patients have put needed medical care on hold, creating entirely new hazards for public health. Our country has suffered. The world has suffered. 184 other countries have suffered. Therefore, my administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states. I've dealt with them now a long time, and we've had a great relationship. Democrat, Republican, the relationship has been good. This strategy is based on hard, verifiable data. I want to thank Dr. Birx for her incredible leadership in crafting these guidelines in consultation with scientists, experts, and medical professionals across government. Dr. Birx will explain the guidelines in more detail in a few moments. And Dr. Fauci has been absolutely terrific. We've all worked together, and we've worked together well. They are interested in the health of our country, and we're all interested in the viability and making us truly great again. We took the greatest economy in the history of the world, and we closed it in order to win this war, and we're in the process of winning it now. Our approach outlines 3 phases in restoring our economic life. We are not opening all at once, but one careful step at a time. And some states will be able to open up sooner than others. Some states are not in the kind of trouble that others are in. Now that we have passed the peak in new cases, we're starting our life again. We're starting rejuvenation of our economy again in a safe and structured and very responsible fashion. Our strategy will continue to protect senior citizens and other vulnerable populations while allowing military and other groups of incredibly talented people to go about their real business and the business that's supposed to be hard at work at doing, and nobody does it better. Our military is the greatest anywhere in the world, and we're so thankful for what they've done. Healthy Americans will now be able to return to work as conditions on the ground allow. Instead of a blanket shutdown, we will pursue a focus on sheltering the highest risk individuals, so important. We're establishing clear scientific metric and benchmarks on testing, new case growth and hospital capacity that must be met before advancing to each phase. And that's each phase specifically in the reopening of our country. This is a gradual process. As the caseload in a state continues to go down, restrictions can continue to be eased and come off. Throughout the process, citizens will continue to be called upon to use all of their weapons in this war, vigorous hygiene, teleworking when possible, staying at home if you feel sick, maintaining social distance, sanitizing commonly used surfaces, and being highly conscious of their surroundings. Those are our weapons, and they're very powerful weapons indeed. Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states. Every state is very different. They're all beautiful. We love them all, but they're very, very different. If they need to remain closed, we will allow them to do that. And if they believe it is time to reopen, we will provide them the freedom and guidance to accomplish that task, and very, very quickly, depending on what they want to do. We are also encouraging states to work together to harmonize their regional efforts. We'll have numerous cases where states have worked and will be working very, very closely together. As we reopen, we know that there will be continued hardships and challenges ahead. Our goal will be to quickly identify and address any outbreaks and put them out rapidly. If the virus returns in the fall, as some scientists think it may, possibly, these guidelines will ensure that our country is up and running so that we can likewise put it out quickly. At the heart of our strategy is the vital role of medical research, especially for therapies that will significantly improve outcomes for high-risk patients and reduce the need for urgent care. This will be tremendously valuable in allowing life to eventually return to normal. At least 35 clinical trials are already underway, including antiviral therapies, immune therapies, and blood therapies in the form of convalescent plasma. You've all heard about some of these events and some of these therapies. They've come a long way. What's been done in the last 4 weeks is incredible. We will also continue to expand our testing capacity. We have now completed more than 3.5 million tests, by far the most anywhere in the world. Areas of our country that have been hot spots have done much more testing on a per capita basis than South Korea. We've done more than South Korea, and South Korea has done a good job, but we've done more. We will continue to work with governors to advise them on how to conduct both surveillance and diagnostic testing. We have now distributed over 600,000 Abbott ID Now point-of-care diagnostic tests. These are tests that are done on site, and within 5 minutes, you know the answer, positive or negative. In recent days, we have seen a dramatic increase in the number of tests performed by hospitals and academic institutions, with more than 120,000 tests recently reported in a single day, far more than any country in the world has ever been able to do. And our numbers are actually going up. As these new and better testing solutions come online, we're seeing this additional capacity reflected in the numbers. For this reason, the number of tests processed in commercial laboratories has dropped from approximately 100,000 to roughly 75,000 tests over the last week. The reason it dropped is because we have so many other tests and we don't even have to go through the laboratories. But the laboratories have tremendous additional capacity, and states feel free to use that capacity. Some in the media falsely reported this as a bad thing, when in fact it is a great thing, because it indicates that the states are moving to faster, more local testing solutions, including on-the-spot tests. So this drop in the utilization of commercial laboratories is an affirmation that testing, which is at an all-time high, is growing at a historic rate. In other words, the laboratories are great, but now we have forms of testing that are much quicker, much better, and we don't have to use the laboratories, but they're there, and they have a great capacity to do the work. As Dr. Birx has been advising our governors for weeks, we continue to have an excess testing capacity of 1 million tests per week available for use, and our capabilities are growing every single day, especially with the new tests that are coming onto the market rapidly. As we begin a science-based reopening, we must be extra vigilant in blocking the foreign entry of the virus from abroad. Border control, travel restrictions, and other limitations on entry are more important than ever to keep the virus in check and allow Americans to get back to work. The sacrifices our citizens have made in this time of crisis will be remembered, studied, honored, and praised for generations to come. We're really all working together. Democrat, Republican, conservative, liberal, we're all working together. This is not about parties. This is about our country. Now the American people are ready to rise to the occasion once again. They are ready to show the world once more that Americans can defeat any challenger. Together we will rebuild this land that we love. We will reclaim the magnificent destiny that we share, and we will carry our nation forward to new heights of greatness and glory. I would now like to ask Vice President Mike Pence and Dr. Birx to further explain the new guidelines. I want to thank Dr. Birx. I want to thank Dr. Fauci, and I want to thank really especially a man who has devoted 24 hours a day to his task force and done such an incredible job, our great Vice President, Mike Pence. Please, Mike.
Thank you, Mr. President. The members of the White House Coronavirus Task Force today joined the President to meet with a bipartisan group of members of the House and of the Senate to get their counsel on the development of what the President unveiled to America's governors this afternoon. The new guidelines for opening up America again are a product of the best science and the best common sense that the President has marshaled on this team and from a broad range of advisors from all across the nation. From the moment President Trump established the White House Coronavirus Task Force early on, he made it clear that we have no higher priority than the health and safety of the American people. The President launched a whole of government approach. And while we stand here on this day with more than 640,000 Americans having contracted the coronavirus, and our hearts go out to the families of the more than 31,000 Americans who lost their lives and those who continue to struggle with serious consequences of the coronavirus. The truth is that because of the decisive action that our president took early on, suspending travel from China and thereafter from portions of Europe and South Korea, screening passengers, because of the strong actions in partnership with every governor across America, because of the extraordinary efforts of America's healthcare workers on the front lines, and because of the cooperation of the American people and God's grace, we are slowing the spread.
As this news conference continues, ABC News is having a special report now analyzing what the president has said with regard to opening the country. So let's listen in.
And by handle, I mean test them quickly with different testing standards, testing anybody that seems sick, and then immediately doing that contact tracing to isolate them. So the purpose of the first half is to let us know when you've got a downward trend, and the purpose of that second half is to make sure you've got the capacity to cut off or stymie any second wave that might revisit.
So, Tom, based on the criteria that we've seen right there, could any of the states meet the criteria right now showing downward trajectory for 14 days?
Yeah, so on the first half of that, trending that I can watch and see with data, a number of states, I'd say a lot of states, I don't want to necessarily go on air with which states should open and be the definitive source on this, but a number of states in the West and Midwest have enough, track record to show that they've not only gone on the downward side of this curve, but they've been there for a while. And so, I'll risk it and say Utah, for example, and a number of others, Montana, North Dakota, Wyoming, they've got a data set that they can show meet that first criteria, this gating criteria. Now, what I don't know, and what will be up to them to demonstrate, is whether they then have a plan, a number of tests, and a contact tracing solution that would allow them to nip any second wave in the bud. But I suspect that if they do, they'll be some of the first states and localities to come back online.
That's a critical point you mentioned right there. I want to bring that to Dr. Jen Ashton. Dr. Ashton, you need to have that testing capacity. You need to have that contact tracing capacity in place to prevent what the president was talking about there in his remarks. If hotspots develop again, a second wave comes.
Exactly. So it's about testing and tracing, and there is still a lot of logistics to be worked out, George, as to how that will be implemented, the accuracy of those testing, how the contact tracing will occur. And we do expect the cases to go up somewhat as these social distancing measures are relaxed and as areas reopen. The key will be how quickly we respond to those cases going up. And George, there are some epidemiologists who issue a strong word of caution that if these cases go up significantly, it will take us more aggressive efforts, more resources to get it back down, and we may not be able to get it back as low as we are right now. So all of this is to be determined.
And which is why you have to have such a great testing capacity. Let me bring in Rebecca Jarvis. Rebecca Jarvis, our Chief Business Economics Correspondent. This, of course, comes on a day the president says we have to get Americans back to work, where we learn another more than 5 million Americans lost their jobs over the last week, 20 million over the last month.
George, that's right. The numbers are staggering. 22 million people have lost their jobs in the last 4 weeks in America, and that wipes out all of the gains of the last decade in terms of jobs since the financial crisis. And I've talked to a number of companies that are also thinking this through, not just what the directives from government will be, but what they will be directing their own employees to do going forward. Starbucks, for example, is putting together a dashboard where they're looking at this data real time, George.
Okay, so there you have it. The president putting out new guidelines for states to follow as they consider reopening America. Our coverage continues on ABC News Live, and World News Tonight with David Muir is coming right up.
This has been a special report from ABC News.